So knowing people is really important. It allows us to have those non-pharmacological interventions, which we'll get to in a moment. But first, I'd love to share a story of James. James has an intellectual disability and he has mental health conditions. He works as an advocate for this Council for Intellectual Disability, and he's going to tell us about some of the strategies he uses to help him in his day-to-day life.
I was diagnosed with OCD, the traits of OCD, high mild depression and high anxiety. I have what's called a stress thermometer. Blue is the safe level. Yellow is frustrated, bit frustrated when services don't work with you and that. Orange is risky thoughts. You might think about doing something wrong. The red is out of control, where you're smashing places up. You're throwing yourself in front of traffic, even though you don't want to kill yourself. So what we do in the orange, we try and get me out of the orange because it's a risk. The orange will actually send me into the red. So once we get down to the yellow, we are at a level where we can talk about it, and that can bring me further down into the blue then. So what we do is we use my cats as support. Jo Asher, the support worker cat, she's registered to the NDIS. There's another cat that's registered called Fluffy. She's not here today. Kylie Singles, a church support worker. And then we have Yvette Proud, past CID participation manager. They're my companions, they're my friends, and they help me calm down and that.
James also told us about his behaviour support plan and how he was involved in developing it.
We need to put in that when I'm upset and that, I don't like staff to pursue me. I like to be left on my own. It was good having my say. And we also said that before staff work with me, they must be trained in my support plan. They must be trained. My support plan has words and it has also pictures of cats on them. It's reviewed by the behaviour support specialist. And then when the review comes on, I'm interviewed again. We have the opportunity to put new stuff on as they occur. There might be new stuff I had in my life, like new stress stuff and that wasn't on the original plan, that have to be put in.
As well as these non-medication strategies, James is also taking psychotropic medicines, which he feels are an important part of his care. He told us how he and his psychiatrist work together.
She works for people with a disability. She also works with my support people, and she's fair in her decisions. She explains the decision. She doesn't say you got to take that and that's it. She explained why she's put me on it. And then she tells me how I can apply for a review if it's not working. And those reviews are normally conducted 3 monthly, unless the NDIS asks for an earlier review, which I had put. She said, we've increased your medication. So she does an assessment on the table. Then she weighs that up in her decision making. And she said, we don't want you to go back to jail. So she weighs that part up too. We're on the same side now. and we are working as a team.